Hi guys, thanks for tuning in. Grace and the Growth podcast. We're here episode 3. Is this our third episode? Fourth episode? Cool. And we have a great friend with us here, Miss Kiana. We are going to talk about all things birth trauma, her birth story, kind of um link together some pieces and just let her explain her story. And hopefully with her telling her story, it can open the doors to healing so women can come and receive and hear and not feel shame or guilt or fear, but just learn from other women's experiences.
Amen.
Yeah, amen. Tell us a little bit about yourself aside from birth.
Okay. Well, I just turned 33 this past month.
Wow, happy
Um
birthday. Aw.
Thank you. Yeah, and this was my first baby. I had been putting off being a mom for a lot of reasons. Just honestly because I held it in such high regard and high esteem. And also I had a lot of goals. I was super ambitious younger. I was in the military. I was in the Air Force. I was like a trauma medic and, really gung ho about saving lives and going overseas and just doing all the things. And then when I got out the height of COVID. And so I was a respiratory therapist in the middle of the pandemic that hit the world. Um,
Jeez.
I was a missionary, lived in Mexico for 5 months, went to Africa, gone all over the country and stuff like that. Also had been married previously and been through a divorce. And so, you know, um, maybe thinking, maybe I'm not gonna have a baby. Maybe I'm not gonna be married again and be able to have a
Mm.
family unit and have a child. Maybe that's just not for me. Maybe the things that the Lord's given me, those are my babies. I even started a boutique and named it one of my baby names because I'm like, maybe I'm just never gonna have a baby.
Mm.
So,
Wow.
the enemy telling me, now you're past 30, maybe you're not going to. And so when I got pregnant, it was a really big deal. It was a really, really big deal. We got pregnant on our first try, literally, like just started using the ovulation even tracker, never even used that before. And we got pregnant immediately. We knew it was going to be a boy. That's what the Lord had told me and promised me. I'm from a little town in Russellville, Arkansas. My mom has 5 daughters.
Wow.
So I was always a girly girl, very in touch with my emotions and very all those things because just growing around all girls. But then also I had a very militant dad that I would go and visit and stuff, and that's how I saw the world, going every summer to visit him and stuff. So, it kept me well-rounded and, like, in touch with diversity. Because if I
Mhm.
hadn't done that, just living in such a small town, I don't think I ever would've done half of the things I did as an adult. A lot of people in my town are still there.
Mhm. And you said you had a class or something. What are you taking right now?
Um, I I've been literally taking classes since I graduated high school in 2011 and like in the military taking classes. I was pre-med before I went to the military. That's how I got my job. But had never finished my bachelor's. Got two associate's degrees, lots of certifications, but never finished my bachelor's. So I'm like, I need to finish this. But now I'm a mom, so, like, I'm not finishing my biomed, like, I'm not gonna use that, I don't wanna go back into the medical field, like, as we were talking about, we realized that mountain is crumbling, what that looks like is different now. I'm like, "I just need to finish a bachelor's degree." So it's in university studies
Hmm.
because I have, like, over 150 credits,
Wow.
but the goal is in January, I will be starting my master's degree, for social work.
Wow. You definitely
So
need that.
yeah, because
Yeah.
after I worked with adults, I segued into working with neonates in the NICU. So, and then I realized, like, once I was gonna be a mom, like, I can't do this.
Yeah.
Like, the separation was really hard, and so how can I help babies? How can I help children? How can I help families without being, again, in that medical field,
Yeah.
doing things to them that I don't agree with, that I don't want to do, and being the hands that did that, stepping away and finding a different avenue. So social work is what I feel led to do.
That's awesome. Good on you.
Yeah.
Good on you. Yeah, relate. I can't I tried stepping back in the medical field. It didn't work out too well for me. So good on you.
Yeah.
Stick with what you believe in and like when you feel that like war within yourself, it's pretty impossible to get any of that work done, at least without like the heaviest of hearts.
Absolutely. And even like the people you work with, there's a really big desensitate how do you say the word?
Yeah, decisive.
Desensification. Yeah.
Yeah. Right.
Yeah, that takes place, and, the people there do, like you said, get
Yeah.
really hardened, especially when it's babies.
Yeah, when you were just explaining your story a little bit before we hit record, I had the thought like, dang, it makes me so mad at myself, well, at the whole picture that like I'm so desensitized to hearing stories like yours. And oh, and because I'm realizing like as we start opening up the floor or as I, say hear a mom's story at church in the nursery, like I am so I'm angry, but, like, so angry and desensitized at the same time, if that I don't know how those
Mhm.
because it's so
It's so
common, like, your
common.
story I've seen played out, and I've been the hands, and it really, like
How can it be so common, but yet, like, literally, I didn't know?
I
I worked,
know!
like, with labor and delivery nurses in the NICU, but I had no idea of the pipeline and the gaslighting and what
Mhm.
takes place. I literally was so naive, and, so that's why it's hard for me to look back because I've always prided myself on being knowledgeable. I've always prided myself on being smart and being bold and not letting anyone, like, you know,
Right,
make me go a direction I don't wanna go, and so
right,
something as amazing and as, like, important as the birth of my baby got hijacked from me and it ended this way, and there's no way to change it,
right.
is so hard
Mm.
to, like, swallow, and that's why I'm like, I have to do this, like, I have to tell people, and if people say, "Oh, how," like, after you have a baby, they just wanna be like, "Oh, how was it?" There's no I Let me send you a link to this podcast I was on so you can watch it because I can't sit here and talk to you about it.
Right.
That's another reason. It's like, I can't answer your question, I'm sorry. It's a
Wow.
long story.
Right. Wow. Well, then I sent it. Let's hear the long story, baby. Like, I mean, and clearly you know that like it started from prenatal. It's not even just like that pipeline you said
Absolutely.
that as soon as
Absolutely.
kind of like a honestly like a pinball game. Like, you're the ball, you drop that ball down in there.
And you have no idea.
You've no
You
idea.
have no idea that everything that they're saying to you, they are grooming you to put you in the position they want you to be in
And they
and get
don't
you to
even
do
know.
these things, and they don't even know that they're a puppet of these grander schemes, of these spiritual, principalities and these I don't even know what they are, just these wickedness in high places that are
Mhm.
just, like, coming after the children.
Kiana, let's start with when you first found out that you were pregnant.
So, when I first found out I was pregnant, I knew, um I needed to find an OBGYN. Initially, I was having some pain implantation.
Implantation.
Yeah. First, I was having some pretty intense implantation cramps, like super intense. Like literally, I was on my period, and because I tested positive on the test, I mean, I Googled it and knew that I was having implantation cramps, but at the same time, like, how severe are these supposed to be? Because like, if you're having a period, then obviously you're miscarrying. So having those thoughts, right? But then they got actually more severe and I actually had to go to the emergency room. So the first time I actually saw my baby on ultrasound was at the emergency room.
Hmm.
And I heard the heartbeat and everything like that. And then I was like, oh my gosh, just tears, just amazingness. So I need to get an OB just to follow up with the care from the emergency room. I was really dehydrated. I didn't know dehydration is so common, even in so early on pregnant. So I was like, okay, I got to get some prenatal care. I'm with the VA, so I had to go through the process of them finding me someone and giving me a list of kind of who I could select. I just look on the list and I'm like, "Holy Spirit, like, I don't know, all these people, like, just see their faces, and it's just like, who do you pick?" Right? But the Holy Spirit had been telling me I was gonna have a natural birth, like, just have a natural birth. I didn't really know what that looked like, I just knew, like, I didn't want epidural. That's pretty much what, like, the extent of it I was thinking, and just, like, fentanyl and just, like, the big name things like that, right? I just looked up, like, which one's holistic, of these, like, what do they put in their bio, just read some bios and, like, picked one. And she looked really pretty young. She owned a yoga studio, so I was like, maybe she's, like even though I know, like, yoga is, like, worship to other gods, stuff like that, a lot of people that are more healthy minded, maybe they don't have that revelation, but they
Mhm.
do, like they're crunchy. You
Yeah.
know what I mean? Like, they're into, like, natural things. So I picked her. Immediately when I went into the office, it was very new, it was very posh. I was like, "Okay, maybe this like a forward." My first impression was like it's very forward moving, like it's very maybe it's more innovative than like an older place or something. So I felt good. She was really, really nice. She was really like girlfriendy, which made me feel comfortable. And she was super flattering, which looking back, I know what was happening. But she was super like, "Oh my gosh, you're so this, you're so that," like, just very, like, flattering me a lot. My
Mhm.
makeup, my hair, my outfits,
Yeah.
whatever, just very flattering. But as it progressed, the compliments turned into mean compliments, and I know you girls know what I mean because there's a lot of mean girls out there, and they'll compliment you, but in a way that makes you feel bad.
Mhm.
Like, they'll be like, "Oh my god, your makeup is so great today." Like,
Mhm.
"Oh, look at you, looking cute again." It's just and I'm like
Yeah.
and I started feeling weird. Like, I started automatically feeling weird. And then I started gaining weight with my pregnancy, obviously. She's just this super fit, almost like in her mid-50s probably, but super, like, young looking fit OB, you know? And so she started being like, "What is your workout routine? What is your diet? Like, what's going on? Like, you're gaining weight pretty quick." Meanwhile, everyone else that I had seen was telling me like, "Wow, you don't even look pregnant. Like, are you pregnant? Like, you don't even look pregnant." And so I was just kinda like, "Okay, well, she's the doctor. If she's saying I'm gaining too much weight or if I need to work out, then I need to work out." But with how sick I was super, super nauseous, like, super nauseous. I mean, not even morning sickness, I mean, like, all day sickness for, like, a good 3 months, and I couldn't work out. I could barely, like, eat. I had so many food aversions that were popping up. My favorite food is bacon, like, growing up, bacon.
Mhm.
Like, I'm a Southern girl, I eat bacon every day. I couldn't even smell bacon. I would
Mm.
get angry at my husband if he even cooked it. Like, it was so bad, like, "Don't get bacon anywhere near me." So it was like I wasn't working out. I was just trying to stay on top of my fluids really because I was constantly dehydrated, constantly having to get IVs and stuff like that. My weight was kind of what she was kind of fixating on and working out. And I was having a lot of pain too in my hips and stuff like that, which I had already had from being in the military. So it was just exasperating that. So at this point, she's really like telling me, okay, you need to you need to be walking, you need to be doing some sort of exercise because like your baby is not and then it went further, but she was like, "Your baby is measuring bigger," as we got more ultrasounds and things. And as the pregnancy progressed, like, I didn't really work out. So every time I went, she would kinda just comment, like, "And you're planning on having this baby naturally? You're planning on having this baby naturally?" And I'm like, "Yeah." Like, "Oh, well, he sure is, um, big for gestational" or what's the acronym? Gestational age, big for gestational age, whatever that is.
Uh, I'm
I
used
can't
to
think of it.
the intrauterine growth restriction, which is smaller, but, big baby.
Yeah.
But yeah, big baby.
Large LGA, LGA,
Oh, okay. Yeah, yeah, yeah.
large for gestational age.
Right.
That's what she was telling me. But when I talked to the ultrasound tech, they were not saying that he was big. So there was already a lot of like
How many
things,
ultrasounds did you get?
a lot. I probably had total throughout the pregnancy, probably like 6.
Holy cow, and nothing no shame on you, but that is malarkey. They should not have done that. I mean, they shouldn't.
Yeah, I
It
mean, especially when I was dehydrated, they were doing more to check for fluid. to make sure my intrauterine fluid and,
Yeah,
like, the fluid that the baby had, the amniotic fluid,
right.
was sufficient enough.
Which
So
is
I
so
was getting it more frequently during that period because
uh,
of the dehydration.
all those numbers are so estimated. I mean, the difference on either side for big baby, small baby,
Mhm.
placenta size, fetal, like, fluid, it's all, like, many
Yeah,
numbers off on either side. It's ugh.
yeah, yeah, which I when I mean, I gave birth to a 7.2 something pound baby. And like I said, most people like, I have pictures of me when I was pregnant, and I'm like, I was not big.
And she's
I was
going
not
straight off
big.
of because you're walking in and you're weighing, like, she's looking at a number.
Yeah, like, I reached 200 pounds, but I'm 155, 160 on a normal
Yeah,
day.
I mean, how tall are you?
I'm almost 5'9". I'm like 5'8" and
Yeah,
a half.
that's a tall woman. That's a tall
Yeah.
baby bearing woman.
My abdomen is very long. Like,
Wow.
it's not my legs that make me long, it's literally my abdomen.
That
So, he had a lot of I mean, he was in there doing cartwheels. We saw his
yeah,
legs
yeah,
doing like, he had room.
God.
But she was just like, I was telling her, like, "I'm in so much pain, my neck, my back, my hips are hurting," and she's like, "It's because 'cause you're not moving enough, you're not." And I was like and I agreed with that. I knew, like, coming from my background, I know how it feels to be fit, but, like, I was in pain because of the weight and just because of how I was carrying. I already had hip dysplasia previously before. Like, my mom has it. It's just a shallow hip joint. It pops. And so that being exasperated, I have bad feet. I'm half black, so my feet are like this. They're flat. There's no arches. So all that going up, the way that your joints work, I was
Yeah,
having a lot of pain.
yeah.
And so she was really blaming it on me not working out and being fit enough. And because I felt so weak, just not even being able to work out and her questioning me every time, it really made me be like, "Can I give birth
Mhm.
naturally? Can I even do this?" And so she's like, "Are you letting me keep that as a backup to give you an epidural?" I'm like, "Absolutely. If something happens and I need an epidural or if I need a C-section, like, of course, I'm not gonna, like, put my baby in jeopardy." You know what I mean? Like, but this is what I want. I want it to be as natural as possible. I don't want an epidural. I don't want any of that pain medicine. Looking back, I didn't do my due diligence. I did not research what the options are for natural. I honestly thought going into an OB, they were going to educate me.
Mhm,
I thought that once we got closer, and I was waiting for it,
mhm.
for as we got closer, for her to start talking to me about different options and what birth can look like and just all these things, or maybe bring in an expert about it and then talk to me. Well, that kind of happened when she referred me to physical therapy. She was like, "Okay, well, we're going to put you in physical therapy, start working with your pelvic floor, start working with your hips and things like that." And I was like, "Awesome." And she told me about these girls. They're like kind of famous in the area. Like they're the only ones she would ever refer anyone to. She's going to send me there. They're super booked, but I get in and I get in regularly with them. And they start educating me. They start telling me, "You're absolutely able to have a natural birth. You're looking better, you're looking good. Just do these things." They're very sweet, they're very helpful, they're very encouraging. I mean, they're on top of me teaching me different moves to have my husband, in for the natural birth and just teaching me different positions, teaching me how to squeeze, just different things. So they were kind of my education. But the issue came where I would take the information they gave me and go back to the OB, and she'd be like, "Oh, they're full of shit." I mean, and she would cuss. "They're full of shit. They don't know what they're talking about." And I'm just like so confused. And I'm like, she's like, and then she would talk, like use her medical knowledge. Like she's been to medical school. And again, coming from the medical background, I revere that. I look up to that, especially a woman who did that. Like, you're a special kind of woman. I know what that takes. So I wanted her knowledge, but I didn't know how to balance it with the different things I was hearing. And so, um, her telling me they're full of crap, that these things are telling me isn't true, and here's why. It just kind of left me being like, honestly, I went into just like looking forward to my physical therapy appointments and really dreading my OB appointments and just trying to like pray and just be like, "Okay, Lord, like you're going to take charge of this. Like you're going to do it. I don't know how, I don't know what." And I was trying to stress. There were some other things going on in my life, and I was just really stressed out. So I was really trying to keep my stress down. I was getting close to the end. It was coming toward the holidays. His due date was January 1st.
Ugh, not fair.
Yeah, which we were really, really excited about having a New Year's baby because every year he'd have fireworks, and we really liked that, right? And she was like, "Okay, you're 39 whatever weeks," like, or even before that, even in November, she was like, "Okay, like, I'm not letting you get to 40 weeks." And I'm like, "What?" Again, I talked with this to my physical therapist, and they're like, "You can go 42 weeks. You're a first-time mom. Like, however long it takes, it doesn't matter." And she's like, "I'm not letting you go to 40 weeks." And I'm like, and I'm alarmed because, like, I'm about to give birth any day. Like, I'm feeling that, like, big, I'm feeling pregnant. You know what I mean? And it's getting toward that time, she's like, "I'm not letting you." And this was after we had gotten into some heated discussions about immunizations. I knew I wasn't getting any immunizations. I knew that. During the military, I've gotten immunized for everything under the
Yeah.
sun, even things in different countries. So you are not gonna immunize me for my baby. I've been immunized for everything. So there's
Yeah.
nothing. So they were trying to tell me, "You need this, you need RSV, you need this." I just knew I wasn't getting any
RSV?
shots. Yes, while I was pregnant.
That's new.
Yeah, while I was pregnant. There was that one and there was another one while I was pregnant. And I was like, "No, I'm not getting anything." And she was cussing at me and my husband. We were sitting there and they're arguing. We were arguing with her, like, bringing our case of, like, why. Even telling her, like, "Look at the generation, look at the output of the youth we see. There's something wrong, and I don't know, I don't have the medical knowledge, I don't even know all the details. I'm just telling you what's happening is bearing bad fruit. Like, these kids got problems, and the only thing I know that's consistent is the uptick in how much crap they're getting pushed into them, and I don't want it for my baby. Whatever I have, he's gonna have. So it just doesn't make sense to me why I need all this stuff, especially pregnant. And
Especially
I already knew when he came out, I wasn't gonna give him all the stuff they wanna give him, when he's first born. So at that point, we kinda had some bad blood already a little bit. She was just really frustrated with me. I mean, was telling me, like, "That's stupid." I mean, just literally, she was just very, very blunt. As I got more pregnant, she got more and more free in her speech
Mm-mm.
with me, and she got really sometimes she wouldn't even see me. She would just have her nurse practitioner or other people see me when I was supposed to see her. It was very like she didn't wanna deal with me. It was like, "Oh, here she is, like, she wants to have a natural birth, she doesn't wanna" she's like, "You don't want me to do my job?" Like, she was just kinda like that, like, "You're not gonna let me do my job? You're not gonna let me do what I need to do?" Like, she was literally getting like that with me. And so it got close to the holidays, his due date's coming up, and she's like, "I'm not letting you get to 40 weeks." And I kinda was just ignoring her, honestly. I'm like, "Whatever. I'm gonna go as long as I need to go." That's what I've been told by my physical therapist, thinking that I could just ignore her. Well, at this point, we're having cervical checks every 2 weeks or whatever. During
Starting
my
at,
cer
when the first one was, like, starting at what week?
I can't remember specifically. I wanna say it was starting somewhere in my 20s.
Huh?
I have to double check, but I wanna say I started somewhere in my
I
20s,
will
my late
personally
20s.
drive. If you got a cervical check in your 2nd trimester, I personally will drive.
I have to I don't even know, but it was
I want your
I
medical
remember
record.
I
They're
think it was
going
32. I think it was 32. I think it
still,
was 32.
dude,
That's crazy. So at that point, you had already like struck her ego. I know more than you. What makes you think that you can tell me more about your birth than I know? And it's like, I'm the one in my body experiencing my birth. What do you mean?
Mhm. Mhm.
That's so horrible. I'm so sorry.
Thank you. Yeah, it was really like and even my husband was like I was like, "Did you not feel how she was acting? Do you not see how she was treating me?" Like, and I'm, like, questioning him because I'm like, I'm feeling really confused. I'm feeling like, "Am I doing something wrong? Like, am I disrespecting her? Am I, like should I just be like, 'Whatever you think,' and just, like, just stop?" Like, I thought that this was gonna be more of a conversation, and I'm not liking it. Like, anytime I say anything, it's becoming a problem, and every time it's getting worse. And I was getting, like, so anxious at this point whenever I had to go to an appointment. I was so nervous. During my cervical checks, she was super disrespectful. She like, you know how you lay down and you have the paper? Well, she would, like, basically move the paper. So I'm just, like, laying there with my vagina, and then she would, do my s and she would do it so hard that I would start having cramps. I would start having cramps, and she literally was like, "Good." She was literally like, "Good, because you need to give birth." Like, literally. She was like, "I need to." Like, I was telling her, it's like, "I'm cramping." Like, "Ow, that hurts so bad." And she's like, "Good."
Is this OBGYN and DFW?
Yeah.
She is.
Yeah. So I'll get to that point later, but she's very infamous. So when I told my physical therapist who it was, they were like, "Oh, okay." She drives around in a Tesla that says Phenom Woman, like Phenom. And that's the name of her clinic. Like, she's infamous. My physical therapist knew exactly who it was when I told them about it. Like, "Oh my gosh, yeah, she's famous for being full med." She wants to do all medical, she wants it super regulated, she wants it super scheduled. That's what she's famous for, and she's famous for her personality, for being very bitchy. So, I get past cervical checks, and finally, I'm to my last appointment. This is the day it all goes. So, I wouldn't let her schedule me. I think she scheduled me anyways, like, because she's like, "I need to get you on my calendar, like, the holidays are coming up, I'm not gonna be here, like, I need to get you on my schedule, like, I'm just gonna put you here, like, somewhere around there because you need to be giving birth anyways." So she's like, My OBs are my operating rooms are filling up, I'm just gonna put you somewhere so I have that slot filled for you, just in case, so that you have it there, so it's reserved." And I'm like, "Okay, whatever." If I give birth at that time, cool, but if
Is this it?
yeah. She's the one in the white shirt all the way on the right.
Bring it back. Zoom in. I'll look her up later.
Yeah, that's
Oh,
her.
dude.
That's her.
Now we know.
That's her. Yeah, she dressed up like Wonder Woman. She has, like, pictures of Wonder Woman, like, of herself all in her office and
Ew,
stuff,
the
and her
God
staff
complex, these.
her staff, like, did, like, the different Marvel superheroes, they all dressed up, so it has all the different, because it's only females there, so they have all the different pictures of them
Oh, and
everywhere.
that's really how they rope you in, too, because they're women.
Mhm. Yeah. If you feel comfortable at first.
Her clinic, like, looks empowering, you know?
It did. It really did. It felt nice in there. It felt like she knew what she was doing, and it was, like, voted number 1 in DFW, like, there's signs everywhere saying number 1 place to give birth. So it makes you feel like if you have a problem, it's you.
Mm,
You know what I mean?
right.
And of course, I wasn't educated enough. I didn't even know where to get educated besides Google, and I didn't Google enough. So, I didn't know what was happening. So it's my last appointment. I'm, like, right at 39 and something. I don't even think I'm to 40 yet. And she just checks the heartbeat, and she's just, like, keeps looking over these, like, it's just well, at first, the tech did it, and she's like, "Oh, there's your baby's heartbeat is a little bit fast. So let me go grab the doctor." Doctor comes in, I'm like, "Maybe it's because 'cause I'm stressed." So then she gets the doctor, and the doctor comes in, and they're like, "Okay, we're setting you up for a 20-minute monitoring. We're gonna check the heartbeat, and then we're gonna see, like, what the patterns are and stuff." So I'm hooked up to this for 20 minutes. I'm just lying there. I'm trying to, like, relax and try and be calm, trying to get my heart rate down, trying to get the baby's heart rate down. My husband's just watching it.
Ugh.
And, she comes in, and she's just staring at it, like, she's just doing like this, and she's just, like, just staring at it, and I'm just like, "What? Like, is it okay?" You know? And, and then she's like, "I need an ultrasound. Give me an ultrasound." So she does an ultrasound. She's like, "We need to see what's going on with this baby." She does an ultrasound right there, and she's like, "You're giving birth today." And I'm like, "What?" She's like, "You're giving birth today. I'm sending you over." And at the time, she had a hamstring injury, so, like, she wasn't delivering. she sent me over and she wasn't going over with me. I was gonna be assigned to whoever was on call that day. And so I'm like, "Okay." She's like, literally, she said, "This is scary shit."
But she's not giving you don't remember, like, a reason?
She said the baby's heart rate was high, and it
That's
was
the
sustained.
that's the dumbest reason I've ever heard.
She said the baby's heart rate is high and it was sustained. Then another doctor called her and she had to like prove why she was sending me over because they were like, "What? Why are you sending her over?" And she was like, and she was just like, "The heart rate sustained, and if it would have done this, then I wouldn't be. But because it's doing this, I'm sending her over." And blah 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 blah. Like she was defending it to another doctor, and
Oh,
so they were like, "Okay, whatever, send her over." So she sends me over by myself. Me and my husband walk over. We go over there, they set us up to the monitors with the nurses and everything. They asked me who my OB was. They start laughing. As soon as they heard her name, they started laughing. They're like, "Oh my gosh, how has that been?" Like, da 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 da. I'm like, it's been rough. Like, it's been hard." And they're like, "Yeah, she just wants everything her way and there's no other way to be." And I'm like, "Yeah, that's how it's been." So they hook me up, they see the heart rate and they're like, "Your baby's fine. Like there's nothing. There's no reason you should be here." So they call her. She answers the phone. It sounds like she's in her car. Sounds like she's in her Tesla. And um they're talking to her and like, "Girl," because they work with her a lot, like, "Girl, why are you sending her over here? Like, there's nothing wrong with her baby. Why are you sending her over?" It was like, "Well, tell her she can go home then. Tell her she can go home." And I'm like, and they're like, "She's making a face." She was like, "Well, tell her she can go. It's up to her." And I'm just like, so
they're
they're just
already there.
yeah, they're looking at me. The Pitocin's already come in the room and isn't into my IV yet.
I bet it is
Not
already coming into the room. Yeah, Michaela, dude, once you better get that rolling. The second they hit the floor, you better get it rolling or you're getting screamed at.
It's already in the room, and so it's just standing there waiting for them to hook me up. And they're like, "It's up to," and they're just looking at me. They're like on the phone with her, and they're just looking at me. They're like, "It's up to you. Do you want to have a baby today?" And I was like, I mean, and that's what she said. She's like, she's making a face because I'm like, "Are you freaking kidding me?"
You already got your IVs in,
My
right?
IV's not in, but I'm
Okay.
laying there like
Still.
naked with my gown on, with my monitors on.
Yeah.
She's told
Right.
me this is scary shit. She's got me worried like about my baby. And so I'm like, I just want to see my baby. I just want to know my baby's okay.
Right. Right.
So I'm like, okay, yeah, start the Pitocin. At this point, I'm still thinking I can have a natural birth.
Right.
Like, I don't even know what's going on in my mind, but I'm still thinking I can give a natural birth. Like, okay, I'm gonna have the artificial hormone that's gonna make me contract, but I'm not gonna have any pain medicine. I'm not gonna have an epidural. So I labor for 5 hours on Pitocin with no medication whatsoever.
And that's
How was
real.
that?
Like, I mean, as soon as that hits your vein, dude, it's like,
That
it's no joke.
that stuff is poison.
Wow.
That was torture. That was literally torture. I literally was looking at he was doing all the moves, he was sweating, like, it was like I was doing all the things I had learned, the positions and stuff, and it was like I was so scared for every contraction to come because it was so intense pain, and it's like torture when, like, you're about to be hit or you're about to be whipped or something, and the anticipation is almost worse than when it's happening. And so I'm sitting there just like trying to catch my breath for the next one. And then the next one, and every time it's more intense. Every single time I had a contraction, it was worse than the one before. And so 5 hours of this, I
No.
was only dilated to a 4.
Yeah. Wow.
I was only dilated to 4, and I knew I had to get to 10. So I'm just like, I can't take this anymore. I can't breathe. I feel like I'm being tortured. I said, "This is torture. I can't do this. I don't know how anyone does this." Because in my mind, this is the natural birth.
Ugh.
It's not like that. It's not supposed to be like that. So, future reference for like when you have more babies, like the Pitocin contractions are not natural contractions. You don't get that rush of real oxytocin that will make you feel like, in a way, like for me, it was a little like euphoric, like in
Mhm.
love, like happy. You don't get that with Pitocin. There's no break, there's no happiness, and it depletes you of your joy.
Oh my
You feel
gosh.
like something's happening to you. It's like your body is rejecting something, like you're vomiting or like you're like it's like that, but to your innermost being. It's
Ugh.
like get it out. And it's like it's literally like you can't think about anything else, and it's just so harsh.
Because that is what it's doing. It's literally only forcing the uterus to contract. None of the other cascades of labor have even started.
He was like, and I look back and I'm like, he was so comfortable. He was fine. Like what did he feel
Ugh.
when that started going through his veins? Like he was just chilling, having a day. Like he had weeks left. And that makes me so, so sad to think that like I was like, yeah, I'd do that. And like how he felt, like he's in there, and he's just like where he needs to be. Everything's going where it needs to go. Nothing else, like you said, no other cascade of anything has happened to let him know it's time to vacate. But all of a sudden, boom, 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 boom. Like, what did he feel?
Yeah. Wow. I never thought about that. I mean, I'm sure I have, but I never really yeah, and I'm assuming his heart rate started dipping.
It didn't. Not that not that I knew of anyways. I mean, they were telling me like I had a great labor nurse. She was really encouraging, really like motivational, and I mean, I've seen labor and delivery nurses. They're very gung ho, they're very fit, they're very, "Whew, let's have a baby today. And I was grateful for that. She's helping me with my positions and stuff like that. They were encouraging me to keep moving, to not just lay down, things like that. So it was good. They were awesome, and then when it came time to push, I had already got the epidural at that point. So I was just laying there, cold, numb, jittering, like just sitting there like tweaking when it was time, when I was finally at 10. I mean, I had blankets and I was just laying there and they're like, "Oh, you're at 10. It's time to have a baby." And I'm like, "Okay." And they're like, they drop the bed, put your legs back, and they're like, "All right, push." And I'm like, I can't feel anything. What am I supposed to push? So
Wow.
I'm just like, yeah, I'm
Mhm.
having a baby. Like just
Mhm.
run down. Like, I don't know. I can't feel anything. So I'm just pushing on. They're like, "Oh my God, you're doing so good. Yeah, just like that." And I'm just pushing with all my might. Like I want to, and I'm just thinking of my baby's face. I'm just like, I just want to see my baby's face. Come out, just you see it in the movies, just woman sweating and pushing. So I just push. They're like, "Okay, you're pushing with your butt. Think up, think up, think up." And I'm like, like,
Oh my gosh.
not my butthole, like, but pushing. I don't know. How do you push from your vagina? When you can't
You
feel it.
don't. That's the kicker is you don't, and they did it wrong. Ah! Oh my
They're like,
gosh.
think up. And I'm like, that's literally the only advice they gave me. And I'm like, okay, up. Uh,
Not my booty hole.
yeah, like, okay, you're blowing out your butt. Like, So then finally the woman comes in that I have no idea who she is the doctor. And she sees that I'm pushing really good, but I guess like every time I'm pushing, he's coming out and they can see his head, but then I release and he's going back. Right? Doctor comes in, she says, boop, pulls him out.
Oh my
I
goodness.
ripped in my butt, my urethra, and my vagina when she did that. Not to mention she grabbed my baby's head.
And this is like shortly after she comes in. She's
Yeah.
like,
Yeah, she didn't say anything to me. She didn't say anything to me.
oh.
She goes down between my legs and pulls my baby's head out. Delivers him.
And see, that's what I mean. Like, that is so common. That is so normal. And it's absolutely infuriating. I mean, especially coming from Michaela's point of view, like to have midwives that do it, but like, it's like you're damned if you do and damned if you don't. Like, you go to the hospital because you want to be safe. You want your baby to be safe. And the whole system is designed to lie through their teeth. And these labor nurses were just like, "Oh, yeah, just get the baby out. Call the
We're
dog."
having a baby today. We're having a baby. And they're being nice and they're being excited
Yeah.
about it. And you're trying to like be happy.
Yeah. Yeah, and then
But
you
you're
so
either in a
gaslit.
agonizing pain or you're tweaked out. Those are your
Yeah.
options.
Yeah. Yeah. Yeah, or I mean, even if you go in and you are like, because I've seen there's women that do come in gung ho for a natural delivery, and they're still made fun of, just absolutely abused and mutilated, and
Called
doctors
stupid.
whoop called stupid. Oh yeah, I mean, I've watched nurses literally rip birth plans down before the doctor comes in. Like, oh, this isn't necessary.
I'm so sorry that happened to you. And I'm sorry that happened to your baby.
Me too. Me too.
So she comes in, she grabs your baby, pulls him out. You tear to pieces. Then what?
Then I have to deliver the placenta. So they just tell me to keep pushing, and then they reach in and do some stuff. They push on my tummy and things like that. My husband told me that they, like, packaged it up really, really carefully and that it made him feel suspect. Knowing what I know now, I'm like, I feel just as, not just as, 'cause it's my son, but, like, that's another thing that really bothers me is, like, what are they doing with that? I want my placenta back. Like, I want my placenta back. Are y'all using that to grow a fake baby? Are y'all using the cells to do something with babies? I know that y'all are doing, or with some sort of, like, stems. I don't know what it is, but, like, they didn't even ask me what I want done with my placenta that I grew for 9 months. And my husband was like, "Yeah, the way that they were treating that thing is getting sent off somewhere." Like, it wasn't like it was being wrapped for biohazard. It's, like, being, like, sent somewhere. Like, they're getting money off of that,
A
is what he told
nice
me.
little box, nice little Tupperware
Yeah.
container.
Yeah.
Uh-huh.
Like, it's weird, and I didn't know, and, obviously, in that moment, you're not like, "Hey, get back here with my placenta," like,
Right.
unless someone tells you to,
You're
"Hey,"
barely
you know.
alive, let alone.
Yeah, and so they just take it away, and I'm like, "Man, it really bothers me not knowing what they did with my body part."
Yeah, I've tried chasing down the people that take them. I've never gotten anywhere to find out where they're going. And I've
Really?
worked at multiple facilities where, yeah, we, as the nurse, you package them up like that with a patient sticker, and then they get a woman usually walks around in scrubs that, but she's got no badge on,
Mm,
and she's getting them to sign them away for science. Send them for
research,
research.
yeah.
Yeah, just it's just then
Yeah.
the patient, like, signs away. But, like, when you're in fresh postpartum and some woman comes in and is like, "Here, sign this to send your placenta for scientific
Well,
research."
that never even happened. No one even said, "Hey, send your placenta for scientific research."
Yeah, and a lot of the times, I mean, they're sent to the lab, and you never.
Yeah, what kinda lab? It's just weird, and it's just, that was another thing that I'm like, that wasn't ever talked to me about. No one ever talked to me about my placenta.
Yeah, they act like it's some that they've officially bamboozled all of our population, that it's waste. It's a waste product anyway. Like, what do you need it for? And we just throw it away. We're doing you a favor and we're throwing it in the
Mhm,
trash.
mhm,
Um,
mhm,
but it's like, that's my organ. I actually
mhm.
would like that. Thanks.
Mhm. Took a lot of work to make
Yeah,
that. I just know the miracle of what the placenta is. Like, the placenta is the biggest part that makes it all possible. All the gas exchange and all the different things that are just
yeah,
unique
and
to only a placenta.
you didn't even get the chance to, like, see it.
Mm-mm.
Yeah, see,
Nope. I didn't
that's
even
some
see it.
trash.
Mm-mm. So, they laid my baby on me. He latches immediately. I knew I was wanted to be a breastfed mom. That was one thing they did talk to me about. So they made sure they got him up there. Um, Warmed him, cleaned out his nose and stuff like that at the table. My husband cut the cord, and that was it. I was in the hospital for, I think, like, 2.5 days or 3 days, something like that. Just managing my tears, honestly.
Oh my
Just
god.
managing just the pain, and now, it's already out about Tylenol, but every 2 hours, ibuprofen and Tylenol,
Yeah, and it's still so.
and stool softener, because my husband looked at it, he was like, "Yeah, this thing is blown out."
Ugh. Gosh.
So I was just sitting on ice and keeping it cool and witch hazel and peeing with rinsing it. And because I had torn also my urethra,
Ugh.
it was super painful to go pee.
Oh my god.
Like everything's torn. So just it was really just managing that, trying to breastfeed my baby, trying to get some rest. It was horrible. It was horrible.
What was going through your mind after that happened?
At that point, I was really just trying to be happy that I had a baby. Like, I was just I was really just like, "My baby's" like, I was telling myself, like, "This is how it is," everyone talks about how painful it is. This is you can get through this, look at your baby. Like, you're a mom now, just focus on, like, this baby and, like, your new role now, feed your baby, change your baby's diaper. I was just trying to get through it.
In survival mode.
Mhm. I was trying to heal, like, I was like, how is my vagina ever gonna be, like,
Yeah.
normal? Like, but you kinda hear that from people, like, "Oh, if you have a vaginal birth, like, your vagina is gonna be wrecked," and stuff like that. Because they had to stitch me. They had to stitch me, so, like, I'm, like, hoping they did a good job. I mean, I just don't really know, So, I'm just trying to focus on just healing and my baby and not to think about it too much and not think about myself really.
They really use that baby as a distraction. Oh my
Mhm.
gosh. Oh my gosh. Yeah, so how old is your baby now?
He'll be 11 months on the 28th, and he'll be a year in December. December
Wow.
28th is his birthday, his anniversary.
Wow.
So it's coming up soon. So that's why I was like, I just need to get this done because
Oh.
it's something I literally haven't thought about. Like, and
Yeah.
Michaela sent me the questions again, and just reading it, it just like flooded back over me.
Yeah.
Like, I just want to lay and cry. Like, if I don't talk about it right now, I'm just gonna probably lay down and cry because it's just something, it's something you look forward to your whole life and something that's supposed to be so beautiful. And then, like, it's something you literally have to shut out of your brain because it's so painful. It's the complete opposite. It's hard to swallow that. It's really hard to be like, "Okay, Lord, but you're gonna" it's like, "But I messed up, but I
Right.
didn't know, but I didn't, but I didn't." It's you blame yourself, and it's like, and it matters. Is one thing I talked to Michaela about in the nursery. It matters how your baby comes into the world,
Mhm.
spiritually, naturally, every kind of way, and that's on me how my baby comes into the world. That was a sign to me how my baby comes into the world, and I failed. Like, I feel like I failed. Like, I didn't protect him, I didn't guard him and know how to do it right, and I gave into fear. Like, literally, that's why I chose, like, "Give me the Pitocin," because I was scared.
Mm.
And it's like, I thought I was more spiritually mature than that, that I knew what fear was. I knew the voice of fear versus love and being of a sound mind. And so I blame myself for that. I went through postpartum depression so bad. I was at a euphoric high when I first got home for a couple weeks, and then the sleeplessness and everything kept in. And I hit postpartum depression really hard. I literally just came out of it probably a couple months ago. And I know that that has to do with the fact, like, of course you're sad. Of course you don't know what to do. Your body's been ripped apart and you've been traumatized. Of course you're going to be sad. I think that there's a spiritual thing that we don't really understand of like what's happening to you and your baby as that moment is happening. And if you don't do that the right way, the way that God ordained, I think the enemy takes advantage of that. And that, I mean, postpartum is anxiety, it's, irritability, it's frustration, it's inability to concentrate, it's all these things. If you look at it, it's fear.
Mhm.
You even have suicidal thoughts, or in some cases, you have thoughts about your baby that
Mhm.
your baby's the problem. Your
Yep.
baby
Oh,
is
yeah.
the issue. If it hadn't been for the baby and you like these crazy thoughts just pop in your head about your baby. No one talks about that,
Mhm.
how the enemy does that. So it's just, I know now, like, the connections between it all. And it's just hard that I allowed that to all happen, you know?
Especially as a first-time mom. And then once you start connecting the dots, it's like you have to kinda re-wrestle with it all.
Exactly. The more you know, the more you go back over it and you're like, I see what was happening. Oh my gosh. And that. And dang, my placenta. And like,
Yeah.
you just think about everything. And it's just like this whole system is geared to have this as the outcome.
You can have more shame and be like, "Well, I shoulda known because I am knowledgeable and I do
Mhm.
know things, and I did research stuff and listen to this person or whatnot," but it's even more, um, impactful that you have that type of background knowledge and now are like, "No, that's what they're doing it like that on purpose."
Mhm.
The second that OB knew she wasn't gonna have to deal with you, but she put in those admission orders, that's money in her pocket.
Mhm.
Like and now you can see that. It's clear as
Mhm.
day. Once the eyes are ready to see, you can't really shut it out.
Yeah.
We do the best with what we have. And at that time, you just didn't have this information, but now you do. And you get to
Mhm.
share your story, and other people will hear it and they'll learn something from it.
Mhm. That's what I'm really hoping. I'm hoping that you guys, get this out there and really like just someone hearing if I would have just heard me say this, it would have changed dramatically the outcome. Dramatically. I never heard. I literally never knew. Like, and again, working so close, like, but we're not with labor and delivery. We come in, we're RTs, we come in to go to a high risk C-section, or we go in where when a labor's gone wrong, we come in, get the airway and stuff like that, and we're out. We're not
Right.
talking to you guys. We're not dealing with you guys. I'm very specialized in what I did. So it wasn't like I mean, I didn't have any idea of like how the doctors deal with their patients, like how the OBs are. I know in the C-sections, they're like, "Oh man, we got another C-section. Let's get this thing. I'm trying to get to lunch. Let's
Mhm.
rip this thing open. Oh, we're getting the girl who's careful and does it layer by layer to prevent scarring. Oh man, dang, we're gonna be in there for a while. I wish we had the dude who just literally just
Oh, they're so
rips them out and like I know I've been behind the scenes with that, so I know how
yeah.
that is, but I did not know that the women who have assigned their role in life, their one job in life, I'm gonna be an OB. They've just foregone all their morals and their values, and they're like, "I don't give a damn, you're stupid. Take these shots. I trust wholly in medicine, and just shut up and do what I need you to do. Like, I
Yeah.
don't care if it's your body. I'm the expert. Do this and hurry up, and I'm going on vacation." I
Yeah.
did not think that
Yeah.
that was what was gonna happen. I
They're
was
they're
so
so
naive.
they're so well indoctrinated. Because 'Cause I'm sure these people did or do have some type of right from wrong, like,
Mhm,
when you go into medicine, like, you have to at least have
mhm.
some type of
Yeah, you take a
education.
Hippocratic oath to
Yeah,
not cause
yeah,
any
like
harm.
but then you think so highly, it's drilled so far into your head that we don't know anything and that the policies and procedures will save baby's life,
Mhm,
that
mhm,
it's so
mhm.
Well, it
And
becomes
again, their
idle.
hearts are hardened.
Idle.
Yeah.
it becomes an
It
idol.
becomes idle. And then after it becomes an idol, that conviction, if you are, a Christian, the conviction that God puts in us starts to, we don't start to listen to it because we've put this idol of medicine in
Medicine.
place. And
Wow.
then we're desensitized.
Wow. Right.
And so that's another thing that, coming from that experience just re-solidified my beliefs with like we talked about before the recording, like that mountain being coming down. That mountain is falling. Like, medicine is not something we can trust in. I mean, look, we can't even take Tylenol anymore. We see that Tylenol causes autism. Like, if like you can't even trust Tylenol, what are these other crazy drugs acting on these
Yeah.
crazy receptor sites doing to us? You know what I mean? If you can't
Right.
even trust over the counter acetaminophen. So
Oh,
it's like,
yeah. It's the crazy thing is that we're also conditioned to just blindly trust the medical system. But once that pillar starts to fall down and you start to
mhm,
see even just the minimal research, I think like a year ago, I started kind of researching acetaminophen, and it's derived from petroleum. And I'm like,
mhm,
wait, Lord, that doesn't make sense. Why would I want to take something that's made from that?
mhm.
You start to question. And once you start to question, it doesn't make sense anymore. It doesn't make sense to blindly trust.
But then it's like, what do? You feel so hopeless. Like, I'm sitting here, this is something I haven't given up, but it's like, I know there has to be some crazy crap in here, but it's like, my turkey meat, my chicken that I just learned is now dipped in ammonia. It's like, what do you do? I
It's a
don't have
lot.
a farm yet. I want one, but I don't have one yet. Like, how am I supposed to survive? And it feels that same way with like your OB. It's like, what's my other options? Like, where are the people? How am I going to do this?
Yeah.
And can I trust myself
Right.
enough and not let fear come in? Because if you think about, okay, I'm just going to do this myself. I'm going to have my mama, I'm going to have my spiritual mama, I'm going to have my sister, and I'm just going to be in my bathroom and I'm going to do this, like, because God is with me and I can do all things through Christ who strengthens me, right? That's really bold, because the thoughts are going to try to attack you and say, but what if the cord's around the baby's neck? But what if they are backwards? But what if you start hemorrhaging?
Mm-hmm.
So what are like
Yeah.
and those things could really happen.
You have to learn about physiological birth because the cord around the neck, 1 in 3 babies are born around the cord around the neck. So what I've learned is that babies are intelligent beings, right? They know the length of their cord. They know what it was like in your womb. It's better for them to be wrapped around the cord than for it to prolapse. So it makes sense why they might wrap around their cord. A breech baby, have your breech baby. Most of the time, when you're going to get a complication from a breech delivery, is because providers are touching baby. You don't want to touch the baby because that's when their baby, the arm can get stuck in the pelvis. And
Or
then,
having mom on their back. I mean, it all
exactly.
any complication that we have instilled in us with fear, any complication we've heard of or we've seen, it primarily happens, and I say primarily heavily, happens in a medically disturbed birth. I mean, these types of things don't happen when mom goes out and squats at a tree. For the past 5, 6 generations, we've been wiped clean. Uh, We don't know how to birth. Our moms didn't
Mm-mm,
naturally. We
mm-mm,
didn't watch mom's birth. We didn't watch our
mm.
grandmas have labor. Our moms didn't watch their moms have babies, and their moms didn't watch their moms have babies. So we have an entire
We've
chunk
lost that.
that has completely lost it. So you're right. Who do we look to? Who do we talk to? The people that used to tell the truth about it got burned at the stake in the
Yeah,
witch
literally.
trials. I don't even care
Yeah.
anymore, y'all. Call me a witch. I'm going to talk about physiological
Mhm,
labor. And if it becomes
mhm,
that we're burning women at the stake because of it, if first time
mhm.
moms don't got to suffer like that, we're going to talk about it.
We need people that are passionate about it, because, like, I look at my baby even now and I'm like, "How did you feel?"
Yeah.
Like, I wonder. Like, he had to have felt scared,
Yeah.
Like, he had to have. Like,
Yeah.
there's no other way, like, and just coming out screaming and like that, like,
Hmm. Yeah, and we wonder why babies come out screaming. It's normal
yeah.
for us to want to hear a baby screaming their face off. Like, if
Mhm,
they're not screaming, it's something's wrong. But it's like, no, I mean, my traumatized baby, my first time baby, she's gonna be 7 in April. And when I tell you I see the trauma inside of her now, I mean, she also ripped through my butthole to relate.
mm, mhm,
Um, but I see, like, she's claustrophobic. No
mm,
6-year-old should have claustrophobia. There should be no reason You know, she's very high anxiety, high stress level.
Mm,
Anything like the drop of something and she is just freaking out.
mm,
Poor thing is like a tightly knit ball of nerves because
mm.
I mean, you know, she was ripped out of me and pulled away from me and taken away from me and before I knew any better. Um, I mean,
But
she it
that's the amazing thing that we as moms and as dads, like, we still have authority over them now, even though this stuff has happened.
yeah,
We have authority to speak over them and say, "Trauma, go.
yeah,
Fear, go.
yeah.
Anxiety, go." Like, I refuse to have Bo, that's the name of my son. It's short for beautiful.
Oh,
Um,
oh,
that I refuse to have him live in fear or live in anxiety, and that's why, like, even though I was struggling with postpartum depression, I was like, "I'm coming out of this." Like, I
yeah.
refuse. I refuse to mother this way. I refuse to let this impact him, like, and just keeping that, like, that prayer just up to the Lord, like, and keeping my son, like, up to the Lord and being like, "Don't let my mistakes
Mm,
impact him in Jesus' name." Like,
mhm,
he's still, even though this happened, like, he's still covered in the blood. He's
mhm,
still he's innocent. There's no way your grace does not abound the more over my weakness. There's
mhm,
no way that you can't cover this. And it's just, like today rereading the story and like knowing that I was going to talk to two ladies, that grief
mhm.
tried to come, and it's like it literally feels like grief.
Yeah,
It literally feels like mourning,
yeah.
like you're mourning something because you are
You are.
mourning the birth you wanted to have. But at the end of the day, like, and that's what I fixed myself on in the hospital. I'm like, my baby's here. My baby's healthy. My baby's okay. My baby is okay. At the end of the day, it didn't happen the way that I wanted it to, and I will not let it happen this way again because I will have more than one baby, but he's okay. He made it.
Mhm.
I made it. Whatever happened to me, I made it.
Yeah.
My mom gave birth in a hospital. She said that she didn't have any medication, like whatever. She just, labored or whatever, but still, I'm sure I was grabbed, I'm sure whatever happened. I was in a hospital, who knows what happened.
Mhm.
I'm still here, we still made it, so God's grace is still enough, but moving forward, I want as many women as I can to know, like, you have another choice.
Mhm.
Like Michaela was telling me, there's a way that you can enjoy it.
Mhm.
Let's redeem, like, this, like God wants to, He wants to restore women. It's like most beautiful, miraculous thing that we have the capability of doing. Like he wants to restore that. This isn't just like something where your husband holds your legs and he's just like, "Oh God,"
Mm,
and
yeah.
you're just being ripped and humiliated. Like it's
Yeah. It
humiliating.
is.
I had to go to the emergency room after because my stitches popped. You aren't allowed to take a bath for however long, like all these things, and you're constantly getting your vagina looked at. You're constantly laying down in front of people and getting your vagina looked at. It's humiliating. It's not supposed to be like that.
No.
The ultrasounds early on are intravaginal.
Uh-huh. Uh,
I mean, all that. I means how many times did my vagina get looked at within the scope of 6 months? I mean, really, it's a lot.
yeah, and which reminds me, Michaela, you had posted about wondering if cervical checks had a spiritual tie.
Guys, that's what I
Yo,
was
dude.
you. Like this doctor that you had hired was into yoga, was into all of that stuff. She inserted your body, even though it was for the name of
Mhm.
medicine.
A
I believe that there's a
violation.
spiritual aspect to allowing somebody to enter our bodies that way.
Mhm.
It's not designed that way. I don't believe that we should be getting fingers shoved inside of our vagina in the name of
Mm-mm.
medicine.
Yeah, it
Mm-mm.
becomes some type of when the day you posted about that, me and my husband have been dabbling into like Old Testament blood covenants. Yeah, and so you posted about that and it got me thinking like we bleed when that kind of stuff happens. You know, we bleed with intravaginal, transvaginal ultrasounds with cervical
Mhm.
checks and it forces us to bleed and then we're like mixing blood with that system. Like
Mm.
just it now that my eyes are open to it, it's bigger than just traumatizing
It
women.
is,
Like,
it is, and there's a reason why you feel traumatized. There's a spiritual
yeah,
reason why you
yeah.
feel traumatized, and when you have these feelings of the mourning and the grief and the defilement and all of it, you know that there's something bigger. You don't know what it is yet, but, like, you can feel, "This is huge. This is huge. Birth is huge."
There was a mom who reached out to me when I posted that, and she was like, yeah, after I had a cervical exam from one of these midwives from the practice, I had like a nightmare of like black widows and spider webs and like crows.
Witchcraft.
Yeah. And then after she had the baby, that midwife wasn't a part of the birth, but after like a what was it, a postnatal appointment, she had her sleeves rolled up and like she saw the tattoos of the things that like she had seen in her dream. And we wonder also why like there's also an increase in postpartum depression, postpartum anxiety, not just talking about Pitocin and epidurals, which all of those heavy narcotics are going to contribute to that.
Mhm.
It steals away your joy. But that violation of allowing this stranger, because you really don't know them, into your body, it's spiritual.
And it's not okay.
We
It's really
really have
not.
it chalked up to just being no big deal, like, everybody does it, and then we wonder why we have this huge gap of not having a clue how to have babies or to mother our babies, not just have the babies.
Yeah, it's birth. I feel like it's supposed to empower you for motherhood, right? But when you're in that system and they steal your voice, it's easier to get a hold of your child.
That's true. That's true, like, because that's something I struggled with, was feeling like I'm not capable of doing this. Like, I'm not capable of being a mom. Like, that lie tries to come even still. And it started with like, well, if you weren't capable of giving birth, I mean, basically, like, like, I had to push or whatever, but it was like those things, it was like he was like almost taken. So it's like if you weren't capable of doing that the right way, then are you capable of doing anything else the right way as a mother? Because that's where it starts. Like you said, that's where mothering starts, is when you give birth. We have to ask the questions of like, okay, so then what do I do? Like, I even know now, like, ultrasounds can be harming to the baby. Cervical checks are harmful. All these things are harmful. Every single step of the system is harmful. So what are you supposed to do? Like, did you not get an ultrasound at all? Do you not get, like, where do you draw that line, and like how do we reframe what that looks like, you know?
This is not medical advice. Do um, what else? This is not, I don't know. Talk to your provider.
Don't talk to your
But
provider.
don't, like, but don't, because if you do, they're like, "Oh, you're stupid. You've been listening to some
It's every
witch."
single step, it's designed to make you doubt your body. Every step of having to
Mhm,
do all the prenatal exams, all of that stuff. How do you know that you have a healthy like baby if you don't come here and take our tests? How do you know if you're healthy? You will know if you allow yourself to feel what it is that you're feeling and not let somebody else's voice come in and be like, this is wrong. Like,
mhm,
I've been working on a post for gestational diabetes, and so many women have been, including myself with my third pregnancy. I remember my medical midwife coming in there and being like, well, you tested high, so you have gestational diabetes. And I remember being so heartbroken. I was like, have I hurt my baby? And it's like, now that I've learned,
mm,
it's like my body was doing exactly what it needed to so that my baby would have enough energy to
mm.
grow and to also keep me healthy.
It's just a new level of trusting God, like, us as women, and that's what the Lord has been speaking to me about in this season, like, primarily, is trusting Him. And there's there, we know the scriptures where it's like, before, I saw you, I knew you in your mother's womb, all these things, I created you fearfully and wonderfully made, all these things. And it's like, but do we really believe that?
Mhm.
Because if we can't see it, we don't believe it. And we want to see it. We want to see the baby on the ultrasound. We want to see it. We want to know how much are we really trusting God? And like, even as a mother now, my baby got a fever and was really like worrying me. Like, he had like a respiratory infection. And for me, that's like I like, when I left the NICU, I was like, "Is there any way I can get an intubation kit, like, to take home?" Just in case, like, you know what I mean? So just because 'cause I'm like, "What do you do?" But it's like, we literally drove to the emergency room with my baby, and we were like, because we were, like, scared. It definitely had all the signs. His lungs sounded horrible, all these things, and we get there, and I'm like, "Wait, wait, 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 wait. What are we doing? We can't take him in there. What are we gonna be subjecting him to? We have no idea what lies they're gonna speak over him, what death they're gonna speak over him. Our words have power, you know what I mean? And so it's like, we can't take him in there." So we prayed and he was healed. Like, and that's like, that means that that's what we're gonna have to do. If I'm saying that I'm not going to take medicine and I'm not going to do this, then that has a domino effect on the rest of my life. It has effect on on my parenting. It has effect on my children. And so if I say no here, I have to say no everywhere to that mountain in my life, to that idol. And that's hard. That is really hard. That's a big commitment as a mom, especially now with all these diseases they're manufacturing that are targeting kids, and they're targeting the lungs and the heart and all these vital organs. Like, what are you gonna do? Are you gonna stand for all of it?
Yeah.
Again, what's that framework? What's that line? There really isn't one yet. And we're just making this up, like, we're figuring it out as we go. We're out here, that hat that says, "I'm just out here trusting God," like, that's what that's what we're wearing. We got kicked out of our pediatric practice. Like, they were like, "Okay, well, I guess we're not gonna have a pediatric, professional." Because we don't want any vaccinations. We just want you to measure him, just take a look at him. There's some things I don't really know about, some birthmarks or whatever. Like, that's really the only thing you're here for, just to make sure, growth plates, and I don't know, really just kind of, again, going in, but not really knowing what you're even here for. Because if anything really bad happens, you're going to take him, they say, take him to the emergency room. So again, do you have a pediatrician? But I know just from my heart, I'm not gonna lay my newborn baby down
At the ultimate medicine. It's
and
literally
let them stick all these
her.
needles in him.
It's an altar. Ew.
Ew. I'm not doing it. Not doing
Yeah,
it.
and I mean, welcome to the club. We don't do it.
I can tell you, my kids are healthier ever since we left that.
Yeah.
And it took some time for me to learn, like, okay, because I had been a part of that and I had allowed these doctors to, like, give them antibiotics and all these things, like, their gut health was wrecked. Their immune system function to heal their body was wrecked. So I had to restore that. I can tell you, they're so healthy now. It takes some time. You learn. You're like, okay, what do I do? God, how do I support the healing process of your body?
And
Yeah.
you find your crew of people that have done it before you and that are standing up, because we definitely can't stand up alone. Cause like, yeah, God can provide us with the wisdom and the truth, but like, it takes other people
It takes
to.
a village.
It takes
And
a village.
that's
You
how it's
gotta
supposed
build
to
your
be.
village, man, because sometimes you can allow, you got like the pediatricians in your village, and it's like, okay, never mind. Or the daycare. No, never
Mm-mm.
mind,
Mm-mm.
you gotta
I
create
know.
your own.
That's what's hard for me right now. I'm like, I don't want my baby around other babies that are like have had all the other inoculations and stuff. He hasn't been around like other babies.
Birth trauma is the gateway drug.
It's like when you get a chicken. You
Yeah.
start
Oh,
getting
I know.
chickens,
Darn
you
it.
start
We both got chickens like at the
I've
same
had
darn
chickens
time.
too.
Oh, how many chickens you got?
Well, I had some and then we
Oh,
moved and we had to get rid of them.
oh,
But it's like that whole thing is like, you get a chicken, you start realizing conspiracies are true.
yeah, right. We're absolutely honored that you chose to share your story with us, let alone whoever logs on to listen to our podcast. We
Oh,
don't
I'm
really
gonna
know.
be sending it to people when it's posted so I can
Yeah, and
here you go.
that's another for anybody listening. It's just a great way to like have your story, somewhere, where
Mhm.
you can refer back to it or you can send it to other people. Yeah. But it
Mhm.
really does take like kind of going back into those trenches to
Mm.
be able to make your way officially up out because you do have to grieve what you lost. You do have to be mad at yourself a little bit, like a righteous
Mhm.
anger type, like I
Mhm.
was bamboozled.
What was stolen from you?
Yeah.
Yeah.
Yeah, but you have to feel those not fun, hard feelings to really reconcile with yourself. I know, Michaela, you've kind of explained to me about repenting like to your baby,
Yeah.
apologizing for the junk that happened and just not knowing any better. But now is like the time where you get to see the redemption of it all, or whatever
Mhm.
stories come after, like, hey, I listened to your podcast and I said no to pitocin, or like
Mhm. Mhm.
we have no idea what's going to cascade after somebody hears. Y'all, thank you so much for joining us and listening in on our friend's story. It takes a lot of bravery and guts and courage to get onto a public platform and say what happened, kind of dig through the truth and dig through the false narrative that was placed over her life. And we thank you for listening. Please share it with friends that you think could be impacted by this, friends that are pregnant, friends that just need to learn a little. And please hit the subscribe button, like the episode. I don't know, social media stuff. Do give us some of that love too. But we'd love to pray for our friend and pray for the listeners. So take it away.
Hold on, I'm gonna pick her up really quick because she's not happy with me.
I got a drooly bub. You are
How
so
old is he, Beth?
a little over 3 months.
Oh my gosh.
Yeah,
Wow,
he,
so
he
you
was
just
our
gave birth.
he was our at home by ourselves for our
Was he
first
your
ones.
first?
No, yeah, my first at home. Yeah, he's our fourth baby,
Wow.
but first untraumatized. So it
Really?
took 4 tries, my guy, and I was a labor and delivery nurse. So
Wow.
Fourth was our number.
yeah, it took
Really?
us 4, and I just assisted a mom's first time home birth like this past Wednesday, and I was like, I'm a little bit angry with you right now because it took me 4 tries to figure this out, and here
Yeah.
you are at home.
That's what it's all about, though.
But that's what it's about.
Yeah, it's those first time moms, man. They're so vulnerable.
Mhm.
So vulnerable. Okay, well, Kiana, do I have authority to just pray over you? Okay.
Absolutely.
Okay. Well, Heavenly Father, we just thank you. Thank you that we have this time together to fellowship, to share, to just hear each other's hearts over this matter, God. I just plead your blood over Kiana, over her mind, over her body, and over her spirit, Lord. I pray that what the enemy stole, God, that you can restore and that you can redeem. I pray that there's healing in her body, that any witchcraft, any type of spiritual soul tie be bound, broken, and sent back into the abyss of hell. Any type of spiritual connection to her OBGYN be gone now in the name of Jesus, that she be set free, completely healed, redeemed, and restored. I pray calmness over her mind, God, peace over her mind, over her heart, Lord, that when the enemy comes and he tries to just speak words of just gross, even just visions, like I see you seeing things, like he puts pictures in your mind.
I have a
Don't
lot of visions. Yeah.
don't partner with it. Rebuke it immediately in the name of Jesus. Satan, I rebuke you.
Yes, Lord.
God, fill her with your spirit, God, that when the enemy comes and he tries to show her those pictures, that she's quick to not partner with it, but to partner with your spirit, God. We thank you, Lord, that you have given her courage to share her story, God, and we pray that it impacts other women, God, that it impacts them before they have to go through it. In Jesus' mighty name, amen.
Amen. Thank you.
Amen.
You're so welcome.
Yeah, I
I
feel like I was getting deliverance. When I get deliverance a lot, I yawn. Like it's a special kind of yawn, and I was like yawning a lot during that.
Oh,
Yeah.
did you ever go back to her?
No. I
Okay.
was supposed to go back for my postnatal and I didn't go and her office never even contacted me. They
That's
never
weird.
even contacted me. They were done with me. They literally were.
Oh my gosh.
But
They didn't even contact me.
you complied.
Not enough, apparently. Not in the spirit. I did not comply in the spirit, and they knew
Right.
it, and that's what they were mad about, and they were done.
Yeah, they
So,
can probably just tell. You can just feel
yeah,
it.
I could just tell, like, even though a lot happened in the natural, I think my spirit man, the Lord has been speaking to me a lot in my spirit, and I think there's some things, even if it happened, like, I didn't make agreements with it, and that's something the Lord has taught me about with innocence. There's still grace, and so I think I can just feel that on me and my baby, that this is a path that I am meant to walk, I am meant to lead other women out, and I am meant to have natural births going forward, and because of the babies I am birthing, our babies are meant for great things, these new generation he's raising up. He's not gonna let them be impeded by just our ignorance or because we're innocent until we know. Like it says in the Bible about like the accountability when you actually learn. So it's like now that we know, now I'm accountable. If I ever say, yeah, give me Pitocin, or if I open my leg and let someone do a cervical check, it's like I know better now. But I will definitely be repenting to my baby because I haven't done that.
Yeah, it's helpful. Maybe not much for them, but for you, it is.
Yeah.
Yeah,
That's
it's helped me a lot. I still apologize to my daughter about stuff, and she looks me dead in the eyes and she goes, "It's okay, Mom. I don't remember any of it." And I'm just like,
It's like I'm speaking to your spirit. I'm not speaking to your mind.